UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. Power. We make it clear every Saturday morning.
Hey, good morning. I'm Vic Senese, and welcome to the UroPatient podcast. Glad to have you on board today. We come to you over social media on LinkedIn, Facebook, YouTube, and X. Hey, if this is your first time checking us out, be sure to go to our website at UroPatient.com. Best place to learn more about the show. Also, best place to see all of our past episodes. We got a bunch of them. And you'll always be able to go and download some helpful hints from our download area. All the stuff that we cover, we have handouts for, so check that out too. Website's the best place to go. Hey, today I'm joined by Alex Hughes, the lead nurse practitioner at Austin Urology Institute, a nationally recognized center for cutting-edge urologic care. Alex brings extensive clinical experience in men's health, advanced prostate care, and patient-centered urology practice. In today's episode, Alex is going to help us break down ProudP. What's that? It's an innovative technology changing the way patients and clinicians track their urinary patterns and prostate health. With a passion for education and commitment to improving outcomes, Alex offers clear insights into how ProudP works, who benefits most, and how it fits into modern urologic practice. So let's bring Alex in to talk about ProudP, and then I'll come back on and I'm going to explain some discounts and stuff you may be interested in.
Hello, everybody. My name is Alex Hughes. I am the lead nurse practitioner out here in Austin, Texas at Austin Urology Institute. I am very excited to talk to everyone about this brand new technology. Well, it's not brand new, but there's a lot of them out there. But one that we really utilize in my practice, in my clinic, and have had a ton of success with is something called ProudP. And what this is an audio monitoring of a urine flow rate. And I've been using it for lots of different kinds of patients. I've been using it for my enlarged prostate patients. I've been using it for my pelvic floor tension patients. I've been using it for my overactive bladder patients. So today I'm just going to kind of review the app for y'all. I'm going to say what its benefits are, what its uses are. So I hope that y'all really enjoy this quick introduction to ProudP. So uroflowmetry, why does it matter and what does it do? It's a simple non-invasive test that measures how well the urine flows. It's crucial in understanding the obstruction of your prostate and early symptoms of bladder disease. It shows how fast your urine comes out, so the urine flow rates, how much urine passes, so your volume, and how long it takes for that urine to come out. So all of those are very important metrics that we use in urology to see if you actually have an issue going on, because so many different things can affect your urination. Medications can affect it in a positive and a negative way. Your diet can affect it. I will tell my patients they need to lay off the coffee, tea, and soda. Those are all bladder irritants. And so if I'm starting a patient on a therapy, or if you're just wanting to check your bladder health, this is a great way of doing it from the comfort of your home. So again, I like to call ProudP like the sixth vital sign, right? So it's like a blood pressure monitor for BPH and prostate health brought home from comprehensive, accurate tracking. So these are all the things that it can actually do, and this is what I utilize for my patients. So the bread and butter is the uroflowmetry. So this actually gives you a flow rate. So that on the far left shows all the data from that. So it'll tell you like a peak urination flow rate. It'll tell you your lowest. It'll actually give you time of seconds, how long it takes you to urinate. Because if you have really bad prostate obstruction or some other issues, it may take you 60 seconds to urinate. That bladder should empty in about 30 seconds. So it can measure that. It'll also measure the volume that's coming out. A lot of times what I'm telling patients is if you go to the bathroom and you only urinate 90 cc's, something's going on. Your urination pattern should be about 200, 250 cc's each time, separated by 3 to 4 hours. So if you're going more frequently and now you can actually monitor that, you may have overactive bladder. Symptom scores. So I utilize the IPSS score like crazy in my practice. That's the International Prostate Symptom Score, and it's a score from 0 to 35. This app has it automatically built in so you can track your own IPSS scores. So if you start taking tamsulosin or alfuzosin or some kind of BPH medicine, you can see your IPSS score and your urine flowometry before and after you start taking the medicine. You can do that also with bladder irritants. You can do that with pelvic floor exercises. So there's so many ways that this app can be utilized, and just for BPH is just scratching the surface. Avoiding diarrhea. I've already alluded to this a little bit. So for overactive bladder, we a lot of times ask our patients to do avoiding diarrhea. And what this entails is everything that you're putting inside your body needs to be documented coming out of your body. So it's intake and output. So this has an area where you can actually utilize that. And then trend lines, right? So anytime I'm in medicine, you look at trend lines. If I'm looking at blood work, I want to see the trends of a PSA. I want to see the trends of your blood sugar. So you can trend your urine flow rates. You can trend your IPSS scores, and it's all nicely packaged in an application on the phone. So seamless data-driven care, patient data flows directly to your doctor. You have an initial trial. You will share this with your physician. Your physician will need to be signed up with the ProudP application. But all of my patients that select us, I get all of their data, and I can actually put it into your chart. So why this is so important is certain, urinary surgeries or may need a requirement of you having 15 mils or less on your urine flow rates. So this gives an official document that you can submit to insurance, and it's all seamlessly sent over to me. Right before I got on this call and right before I started doing this webinar, I was actually on my portal looking at my patients' urine flow rates. And what I really like to see, or if I do a patient's procedure, right? If I do an aquablation or a urolift on a patient, I want to see their pre-urine flow measurements as much as I want to see their post-urine flow measurements. So checking your urine flow before and after treatment, even if that's medications or surgeries, is imperative, not only for us as a practice, but for you. You want to make sure that you're doing the right things to increase your urine flow and making your bladder health even better. So this is my data. This is literally from my dashboard. So you can see on the far left, this was a patient on October 21st of 2025. They did 5 tests for me. And so what I love about that is, especially if my patients are coffee drinkers in the morning, they will come into me and they'll be like, I don't have a problem all the time, but maybe my stream's a little weak in the morning, or I have some leakage during the morning time. And a lot of times we're drinking bladder irritants in the morning, and you can catch that. You can see, your urine flow rate's less in the morning and it's actually better in the evening. Maybe that's something that's dietary that's kind of causing that. These are just the middle picture is what I'm pointing at here. These are all of my patients and their tests. You can see this second patient has sent in over 1,000 urine tests. So you can actually utilize this, and there's no amount of tests that you have a max for. So you can really check almost every urination. This is an example of a typical urine flow rate. This was a pre-aquablation patient. So you can see on the far right, my head's kind of blocking it, but the urine volume was around 360 cc, so it was a good urine volume. But look at how much time they took. It took about 40 seconds for them to get that 360 cc's out, and they were barely hitting about 15 mils per second. So definitely some obstruction. That same patient submitted an IPSS score. So you can see on this IPSS score, they had a severe symptoms of a 23. So all of this data is utilized as an all-encompassing picture of what's going on with the actual patient. And we can offer a specific treatment so that we can actually get this patient treated, whether that be medications or a surgical route. So when best to use ProudP for at-home testing? Before visiting your doctor, obviously check your symptoms at home, get your IPSS score out of the way, get your urine flow rates out of the way, and bring that data to your doctor. While you're on your medications, I talked about this a bit. A lot of times I'll have patients that'll come in and be like, I don't think this medicine is working for me. And I said, well, why don't we check it? Why don't we do some urine flowometry? And do your urine flowometry before you start the meds, or if you're on the meds, do it while you're on the medications. Excuse me. And then check it 2 weeks after. Go off your meds. If your urine flow has decreased, then you know that the medicines were working. If it's not changed much at all, maybe you have overactive bladder. Maybe you have some pelvic floor dysfunction where we need to really kind of start focusing on. And of course, before and after surgery, this is so important. You want to confirm that the surgery is helping you, and especially if you go off of medications, you want to make sure that the surgery is still opening up the prostate obstruction. So it's extremely easy to use. My number one question from patients are like, what if I can't use it? What if the app is too complicated? They have made this thing so simple. My 50-year-olds can do it, and my 100-year-olds can do it. I think my oldest patient that's completed it is around 96. So basically, you open up the app, and again, what I do in my clinic is I actually have it on my phone. So I will open it up, and I will show the patient. I will actually do a test by the sink, and I'll show them how to actually use the app. But basically, you put the phone around the toilet. And so you can put it above the tank there. You can put it on the sink. You can put it on the bathtub, anywhere so that it can pick up the audio. And you open up the app, and then you push analyze, so that start button, and then you start peeing. No sitting at this time, because that audio will actually get hit by your bottom and your legs. So you do have to be standing for this. And you want to make sure the urine hits the water in the center of the toilet bowl. Once you're done urinating, you hit finish, and then it sends the analysis directly to your physician. It is that easy. I have had so many successful patients with it, and it's not as hard as what a lot of people will make it out to be. I absolutely love the technology. It has been a huge, fantastic thing for my patients. And what I always tell everyone is home monitoring is where it's going to be. Like I had a stepfather that had congestive heart failure, and he had a blood pressure monitor and a scale at his house that automatically reported all this to his cardiologist. So home monitoring, it's where you're at, it's where you're comfortable. You don't have to come in and do a standing urine test with electrodes all over you. So home monitoring is where it's going to be. And I absolutely love the technology for my patients. So you can actually get a free trial, download the app, connect with your doctor, can scan this QR code, and then you can actually use these promo codes.
Okay. So thanks, Alex. That was great. Now let's get down to the nitty gritty. If you really thought that product is something that you could use, and boy, I think it is, I've got some information for you right now. So let's talk a little bit about the ProudP. It's a way of really monitoring your flow rate, as Alex mentioned, with no wires, no cups, no anything hooked up to you. Just works on sound. And folks, I've tried this thing, and it works. It's amazing. Just listens to you pee like normal. And the only requirement is you have to have a phone with the app, and it has to be somewhat close to you. It doesn't have to be right next to you when you're going. And it'll analyze the sound of the water the urine hitting the water to figure out the flow rate. And I'm telling you, this thing is really accurate. And why does that matter so much? As Alex kind of talked about, knowing your flow rate is way helpful for us to determine whether you've got prostate issues that need to be treated. So this really almost non-invasive at-home test, which will give your doctor more information because you can get it over many different times that you're going and checking your flow rate, because it could vary day to, hour to hour during the day. So you get this much better result. So anyway, here's the good news coming to you. If you're going to go and get this, you'll get one free trial. So you get to download it, try it out, see how it works for you. And if you like it, you're going to want to do a few of these tests. Well, you can choose between a one-time test, a monthly plan, or a yearly plan. Now, depending on which plan you choose, and it's up to you, I would recommend probably at least the monthly plan would make the most sense. But anyway, you can get 10% off. The company has worked a deal out with us for you to get 10% off of those prices just by using these codes you see right here. EuroMo10, that's for the monthly, and Euro Year 10, YR10, that would be for the yearly. Either one, you're going to get 10% off for that entire time. So, hey, you want to try this out, you want to save money, I would advise you go and get this, go to our website. We're going to have all these codes. You see that QR code, you'll be able to scan that to get to the download for the ProudP. It's available on, unfortunately, if you're not an iPhone user, it won't work. Right now, they're working on getting the Android. I don't know if that's out yet. But if you're an iPhone user, you can go to the Apple area to go and download that. Like I said, that QR code will work. All this is going to be on the UroPatient website. And we'll also have it on our UroNurse website, because I think for you practitioners that may have watched this, this is a great tool that you could utilize in your office too. So I think it's going to be something that could be a game changer. Anyway, we did want to make this available for you guys, so I hope you enjoyed the episode. And with that, I'm good for this week. Hey, it's getting to be close to Christmas time. Hope you like our decorations in the back. And we'll see everybody next week on UroPatient.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. Is here.